Taught us today, okay? So we were talking about neurobiology yesterday. So what is the basic unit of nervous system? Is neurons, right? So neurons are the one which take care of everything what is happening in our brain or in our body. So neurons has the property to receive and to send also, like it at the same time it receives and at the same time it sends also. So we have, like, you have to draw this neuron structure basically, because it is dendrites, this is dendrites, like it has lot of dendrites in it. It has a cell body. The proteins transfer, this is DNA here, the protein transfers in this way from the from the nucleus to the cell body. It moves through the microtubules, it gets into the dendrites. Okay. So we have a connection between two neurons, like there is another axons, same neurons here. Okay. So this is how it is getting connected. So what we spoke yesterday, they send some chemicals towards this junction and this receives, right. So these chemicals are called as neurotransmitters. Okay. It is very important to know the term neurotransmitter, that is enough. So we have like serotonin, dopamine, and epinephrine or GABA, all these are the neurotransmitters. So when this neurotransmitters has a specific function, for example, in case of anxiety and stress and depression, most of the time the serotonin is the thing which is responsible. Serotonin, the neurotransmitter serotonin is the one which is responsible. So
for the stress,
yeah, for the stress or anxiety or disorders or any depression, psychological depression, serotonin. And the second thing is dopamine. Dopamine is the stress hormone, or the happy hormone. If given to a person, their mood gets good. But the serotonin is more responsible for the depression and all those things. Serotonin, dopamine, we have stress in the normal conditions, like whenever we get we have a talk tomorrow, we have exam tomorrow, we have some conditions tomorrow, person have marriage tomorrow, everybody is under stress, but it is normal if it is regarding the event. But when you have after the event also, and it is pertaining or it remains there, then it changes into anxiety, longer time, okay, anxiety. So when the anxiety goes on, it becomes habitual, the person is basically having a long term depression, okay, depression. So there is some condition called as post traumatic conditions, whereas the person is encountering with some trauma, but then it causes at a point it causes a strain there. So the person is going under depression, but they cannot identify it, and this occurs in a time period. Whenever this something related to this event occurs, or whenever this things comes up or anything related to it comes up, you have this post traumatic effect. Okay. So what is the symptoms of it? What are the symptoms? The person may have overeating or lack the appetite completely, anorexia, right. So they won't have any appetite either, or else they will be eating junk a lot, whatever they get, they crave for it, they just eat on it. First symptoms. Second symptoms, they are completely disconnected with the world.
only for anxiety.
all of the conditions, you know, we have different stages or different types of anxiety, different types of depression. So there are 8 types of anxieties or something, and a lot of types of depression as well. So it is according to the scales you have, like, you know, you have lot of questioners in the sense, you will form a pattern of questions where you have to answer, where the person has to answer, and this person, when they're answering, will identify where it falls, where they falls. Okay, so questions will be like, how many times you eat today, what you feel, how you handle it. Okay, so the questionnaires are developed already on the basis of a lot of trials and errors. They make certain questions, and then you have to, you might have attended some questionnaires, like, you know, out of 5 scale, you tick this, you tick this, you tick this. You might have got a lot of questionnaires like that. So the initially it was called as psychology, but psychology is not scientific anymore, because psychology deals with the questionnaires pattern. It do not deals with the neurobiology. It was under physiology. Psychology was under physiology, but it is not categorized anymore. So now it is psychiatry. Even psychiatry was something related to it, but now everything they are turning into neurobiology. They feel like physical or something which can be quantifiable. Quantifiable is like we can measure it, is actually neurobiology. But before, it was according to behavior pattern, regarding the characters, the result, you know.
So you can.
Or how we used to do it, like, you know, diagnosis and all, we used to, it was based on questionnaires, like what your response is. The speciality of neurobiology is you cannot see anything. For example, if you have a cramp or problem in your stomach, you can do MRI, oh, this is here, the cut is here. But in neurobiology, if somebody is suffering due to some anxiety or something, you cannot see it, right? You cannot open cut where the problem is, you cannot see it. And also the neurons, to measure that, neurons has to be working, you know, neurons has to be working, then only it will give a output in the sense behavior pattern. Okay, so if behavior pattern is not there, then only we can only identify through the output. But now they are identifying in the working property. There are a lot of methods to identify it. First method is electrophysiology. Okay, electrophysiology, when you work with the single neurons and you insert the rods inside, when you insert the rods, you will see, you will measure the electricity passing through it. So that is electrophysiology. You have you heard about patch clamps? Patch clamps. Yeah, there are some methods called as patch. It's very latest methods. This, what I am talking about, are very latest method which are right now upcoming in the research field. Okay, so what do they do is, I said this neurons have electricity all over the cell. So these are the ions, right? Ions, nothing but the ions, plus, positive, negative. The electricity is nothing but the positive, right? Electrons, negative electrons. So the negative electrons, there is a whole system how it changes, because normally in the cells, when it is negative outside, it is positive inside, or positive outside, negative inside. This is called as osmoregulation. Okay, when the cells has to shoot, it changes it electricity. How it changes? By changing the minerals like sodium, potassium, calcium, all in and out. When it changes that, it basically changes it ions inside. So it maintains a isoelectric. Then the positive and the negative. So we measure it. We put a patch clamp, this part, and then we see how the electricity is transferring. Okay, that is called as electrophysiology. It was first used for the heart. The heart, because the heart, I told you yesterday, the heart has the electricity, right? Okay, but now the electrophysiology they are using for the neurons, so that they can identify how the cell works. Okay, there is another technique I wanted to just inform you, like it's optogenetics. Electrophysiology, and another one is optogenetics. Opto means light, genetics means it's something related to gene. Okay. So, what do they do is they modify this gene. I told you every organ of our body works on proteins. Everything is protein. Everything in the body is proteins. So, how this protein reacts? This protein are the major part of behavior. What do they do? They identify this protein is responsible for movement. For example, certain proteins which are responsible for movement. What did they do? They went into the gene. They went into the gene. The gene which synthesized this protein, this particular movement which is responsible for movement, and they put a gene which is fluorescence, some light, light activated. Really it's very interesting. So, when this protein gets formed in the body out of neurons, along with that the gene which they have inserted inside, this also starts replicating the proteins with it. Now, the thing is they can operate it with light. So, when you flash a particular nanometer light, for example, the protein gets activated in blue light, the flash blue light, the worm stops moving, the organism stops moving. You are manipulating the behavior of an organism completely with a light. You understood? Do you want me to repeat the mechanism? Okay. So, imagine in a human being, when you identify those protein which are responsible with certain behavior, for example, I want to move and they tag it, my protein is tagged with their light proteins, and they flash a light and I will behave exactly the way they want me to. You understand?
The light will behave.
No, the light will take it is like operation, like you are controlling it. The light is controller. You flash this particular nanometer, you will stop. You flash the other, you switch off this, you will start moving. You imagine if it is done.
So it's not actually.
It's not done in human beings, but it's been already established completely in organisms. Worms and all, they flash the light, it stops moving. They stop the light, it starts moving. I'll show you the video. It's very beautiful. You have the phone, right? You just type in. You can type. Thoughts are different from the neurobiology, but scientists now claim that thoughts are also in the neurobiology. But yoga do not support it because it's in the Sukshma Sharira. Thoughts are originated in the Sukshma Sharira. Dhyana, the brain. The brain is just a part of, according to yoga, the brain is just a part of a big mind. Consciousness or mind is a huge thing, but brain is the smallest thing. So, science say everything is in the brain. Yoga and philosophy says everything is in the mind, buddhi. Okay. So, right now we are dealing with only with brain, how brain works. So, brain is something which is related to behaviors, right. All the psychological disorder, even though we can manipulate it with brain, but we cannot manipulate the thoughts. So, you can play with the brain around. So, what are the treatments for it? Serotonin pathway causes the brain to behave, you block the serotonin pathway. That is a treatment. You block the serotonin pathway
Completely.
with the drugs. Serotonin, selective serotonin inhibitor, receptor inhibitors, which inhibit, stops,
So you take medicine which disconnects from.
which do not allow the serotonin to pass into this. So, the pathway will not continue. So, the person will not have depression. But
the serotonin is still there, right?
no, but the serotonin is responsible for so many other things.
All the feelings, right?
All the feelings, emotions, the movement, the social connections,
Like this when they took too much medicine.
they won't be able to do anything. They will not be depressed because they cannot think. They will not have a thought process. They cannot think. Their brain is not working. the drowsy.
Yeah.
The person who are taking, those who are taking drugs for this antidepressant.
So, but they are thinking, but they are not feeling emotions.
No,
right?
they are not even able to think normally because, for example, a person who is totally in a depression stage, you starve them, you don't give food. He is so hungry, or else you give him some pain. Depression because of some loss of some person. Other person comes, he starts torturing him. Now the depression shifts. Depression shift from the lost person to the pain. Now he don't have time to think about that. He's still depressed because of some other pain. But then he is getting, see her condition. Thus, when we are controlling something neurologically, what do? We just stop the whole procedure. But there are psychotherapies, cognitive behavior therapies. There are psychotherapy. What do they do in that? They train the brain to shift the thoughts. The psychology, there is a difference between psychiatry and psychology. Psychiatries, they deal with drugs basically. They give a lot of drugs, and psychiatry, those who are MBBS doctors, they can only do. Psychology, PhD, MA, psychiatry, they don't deal with the drugs, but they give this therapy. Yoga therapist, they give the therapy for it. We have our own things of therapies, right? We are full of therapies. What are the main therapies for us? Yama, niyama, meditation, these all ahara. These all are the therapies for us, right? And with this, what are the psychotherapies? There are a lot of psychotherapies where they indulge the brain into certain things. For example, physical activities they give, which are fun. They give certain traumas, kind of breathing techniques, like, you stop your breathing for a while, you get trauma, you cannot, you have to breathe after that. So when it is repeated, your complete mind is concentrated on that therapy. It's a bit difficult and it's riskier also, but then also again, cardboard therapy, chair therapies. Chair therapies, they'll put another chair, they'll ask them to share everything to the person. Imagine somebody is sitting and you share everything to the other person. Okay, these are the therapies normally psychologists use. Then other therapies like, board games, and then they measure what is your EQ level, emotional level, and all those things will be there. Okay, then they ask you to share with your families, friends, and sorry, it happens automatically. People imagine themselves with certain people. That is called a schizophrenia. You have hallucinations, like few people are already with you, and whatever you tell the person that it's not there, they won't believe because they are seeing it, they are sensing it. They will not be able to feel like that's not how it works. So that is schizophrenic conditions. Yeah. So in normal depression and anxiety, other symptom is these people will go silent. Maybe the person will be very extrovert, they become very introvert. The person was very introvert, they become very extrovert sometimes. Yeah, because they want to share their things to someone, and they'll just go out, they'll speak something. They become socially very anxiety. They have too much of social anxiety sometimes. Like they don't want to face any crowd anymore. Their confidence level will go down. They'll be so, and in the later stage of depression, when it is high depression, the person don't want to move his body. They'll be just remaining at a part. For example, dealing with some, dealing with some heartbreaks, loss of a person, having some disease. This person will be totally, when they are not becoming positive, everything is in the brain, right? So more you think about it, more that same pathway you are activating again and again. It's circulating, and after this brain is has a property, it is habituated. The habit, so habit, how it grows? First, one day habit. You remember, you read something in one day, You repeat something for 1 day, you use the same thing for the 3rd day, imprinting. You use the same thing on the 7th day, more imprinted. You use it on the 30th day, more imprinted. In 1 year, more imprinted forever. That's how we read, that's how we learn. What you read for the day, you can revise it tomorrow. Now you revise it on the 3rd day. From the day to the 3rd day. Then you revise it on the 7th day. Then you revise on the 30th day of the month. Then you revise after 1 year. And then you don't have to revise ever. That's a long-term memory. So we have 2 portions in the brain, short-term memory and long-term memory. Short-term memory happens in hippocampus. Hippocampus. Okay, this is called as STM, and the long term is called as LTAM. So STAM is in the hippocampus, and the LTM is in the cortex.
AM is what? So short
It's
term.
short term. There is a whole full form for this. Something I don't remember. So short term.
Not
Yeah.
even you can remember.
Solution. How to find happiness within yourself.
Nothing.
What is it?
Nothing. Yeah, with laughing, laugh.
Okay, laughing.
Laughing, yeah. Right, no?
Yeah. So
You can do that
yeah,
yourself.
because whenever, even if you are not happy but you start laughing,
It works, right?
the dopamine gets released. It works and it becomes your habit. But the problem is, if you find that thing also, and if you are going under depression and you start laughing in the public, I don't know, you know, you have watched this movie Joker. He cannot stop whenever he gets panic attacks.
What you suggest to more learn about it?
Everybody has their enjoyment point. Most of the people, the best thing if you are under depression, what is my suggestion is, change your location. Change your location completely. Travel is the best method. Why?
Also externally.
Externally, but you cannot shift. I told you, brain is
Take yourself
habituated.
with you.
Brain is habituated already. You cannot perform all of a sudden something which you are not habituated to. If I ask you, stop thinking and concentrate on your meditation, if you are heartbroken today, you will go under depression again. Why? Because in meditation you will think again and again more, because you are habituated from many months about that. You cannot change. The brain is a thing which makes a pathway. It's very difficult to stop that pathway. So you have to make everything into a habit in a longer term. You cannot stop all of a sudden anything. You cannot start all of a sudden anything.
It's easier to start new from another location.
It's
Because your mind is
easier.
not, like, reminded
It's
to everything.
still your brain is working in that way, but your physical condition which are attached, because you do associations. For example, you see you are breaking with a person, right? So the person comes, the things he has given to you, the places where you visited, the smell, the things around you, the locations, everything will remind you, because brain is a thing which loves associations. And these all things are associated with the happiness he has given to you. So you are addicted not to the person, you are addicted to the happiness he has given to you. Now you are in pain, maybe, like, because when you are going for a breakup, maybe you are into pain, right? Or you may lose the person, you are in a pain, right? You are not associated with the pain. What we want for us, we want happiness for us, right? We always search for the happiness. What is good for me is happiness. So what I am addicted to is basically happiness. I want to produce dopamine more. So I'll search again, please, because my happiness is associated with him. If he is there or she is there, now I am happy. So I'll try to find out, which will never happen. Why? Because you have to change the entire system, because the fights or the problems has become a habit now. The happiness is not habit anymore. So you have to take a complete break and reverse it. Reverse it, not the relationship, not the thought process, not the memory. Reverse your own brain. The problem is not with the other person or anything. The problem is with Vairagya. Vairagya. Vairagya is detachment. You do anything in this world, you enjoy, don't get attached. What is attachment? Happiness should not be attached with it. You should be happy. If you are not getting, still you should be happy. And you should develop the habit of it. You cannot make it all of a sudden, like, all of a sudden. I won't realize that that thing is becoming my happiness. I won't realize, and I am getting into a habit. I won't realize it. So, the Vairagya is the first thing which yoga teaches us. Enjoy the world. Enjoy the world. But don't get attached to it. Next is, don't think about the result or fruit of it. When we are doing something in the moment, dopamine gets released. But when we want to achieve something, oh, this is the result I want, then serotonin gets released. Right? So you enjoy what you are doing, but you don't enjoy the result of it. Even if it is good, you don't have to be happy. Even if it is bad, you don't have to be in a painful situation. But what you did, I enjoyed it because you have released enough dopamine for yourself. Right? So that's how the neurobiology of it works. Clear?
In a psychological.
Agya and Abhyasa. Abhyasa is practicing. As I said, brain is a thing which is addicted to the habits. So, Abhyasa is practicing. So, when first how brain works? First, anything you are thinking about, it starts from the physical level. You make your, when you are too much into something, your entire body, without you realize, it will work towards it. You understand, right? Like, you are playing a sports, you are too much excited about it, you are each and every part of your body works towards it without you realize. You don't have a voluntary control over it. It works automatically. Thoughts. Abhyasa is a practicing. When you do it for a longer term, automatically your physical body get habituated to it first. Then your mind gets addicted to it. You become addicted, or you become something to with your mind. So, physical first, mental second. Then third is manas according to yoga. So, in yoga, in Sankhya philosophy, there is a whole evolutionary chart. He might be teaching you how buddhi, manas, ahankara, then we have our gross body, like the senses and all, it comes to the gross body. So, where I was, yeah. So, that is how it is done. Okay. So, we have done the symptoms, we have done the diagnosis, how it is diagnosed, yeah. Symptoms, like, you have all this, yeah. Then your mental state affects the symptoms. Another symptoms is physiological symptoms. When you are under stress, first thing you will lose is appetite, or you will be craving a lot. Second thing, diarrhea, loose motions or constipation. Second thing. Third thing, your entire systems get collapsed. Starts respiration, your circulatory system, then it in later on endocrine system which is going to give you thyroid, diabetes, then obesity, PCOD, PCOS. Every endocrine system will be affected the longer term of stress, right? So, the physiology, sorry, talking about apnea yesterday. So, you were talking about apnea, right, yesterday?
Yeah, but what's for another? Yeah.
Okay. So, that is basically called a sleep apnea, because you will not get, you will get this respiratory system during your sleep and you have attacks. So, you will not get a proper sleep. Insomnia, where you are totally, do you want me to write all these words? No, right? Okay, okay. Insomnia, you will not, you will not have a proper sleep at all. You will,
और PSDCH क्या बोला है आपने?
PCOS, PCOD, polycystic fibrosis, PCOD, PCOS syndrome, then ovary syndrome. To understand the neurobiology of it, and I was talking about short term and long term. Short term is in hippocampus. Yeah, it's very important to understand how the memory is stored, okay. So the memory starts from the neurobiology. You have heard about this pen drives, right? Pen drives, pen drives. Pen drives we use for computers, SSD cards. Yeah, pen drives. There are two kinds. Yesterday I was talking about. One is hard disk, which is work on the magnetism. The second one is SSDs. It works on the electrons. Binary divisions 0 1 0 1. That's how it stores. So it's called as flash storage. It's called as flash storage, right? So how does it store? If you know the mechanism, electrons passes, calculates as 1. Electricity passes, calculate as 1. Electricity off, calculated as 0. You understand, right? Yeah. So it makes the codes. How it makes? For example, 10100. This is a functionality for A, maybe. I am just giving you a guess. In the neurons also it works in the same way. Electricity pass 1, takes a second 0, pass 1, takes a second gap 0, 1010, now it takes it as a code. Flash drive, same. Now it is been stored in hippocampus. There is a place, for example, this is my brain. In between there is a place called as hippocampus. It looks something like C shape. Now whatever I remember today, it's stored in my hippocampus. Whatever I read right now, it's stored in my hippocampus. It is short term memory. The maximum is 3 to 6 hours. Short term memories. I cannot recall from there once it goes beyond that. But or else I have to revise it continuously for 6 hours. When I sleep, the entire memory from hippocampus comes to the upper layer of cortex, that is stored as long term memory. Getting it? So the person who don't sleep, they cannot convert their memory into long term memory.
So it's better to learn before you sleep.
It's whatever I am learning today, when I am sleeping, it is transformed into the long term memory.
But then I mean, like, what it happens in the morning? It just
No, it's not like that. It's stored. It's a storage. You dump. It's, for example, you have a whole room. You're dumping. The moment you go to sleep, it just transferred at that time to the cortex.
So in the morning you're.
It's not morning, evening. You learn for the night. The moment you're sleeping, in the morning it will be transferred to the long term.
because you said that the information stayed there for 6 hours.
3 to 6 hours. Yeah.
And then
Then you have. I said no. You have to recall it. In 6 hours, you might be recalling it again. In that 6 hours, if you are not recalling it for 6 hours, it will be gone. But if you are recalling it again in 6 hours, sometimes, for example, I am learning a word from her. You said yesterday, how do I remember? Because I learned from her. After 3 hours, I revised it. Next morning, I'll repeat it again, once again. It will be transferred in my long-term memory. That's how I remember. So everybody can remember because I know the pattern. Everybody knows the pattern now. You can remember anything. Because morning I learn something from her. What I do, I repeat it in the evening because I have to give a strike again. When I sleep, it goes to long-term memory, but it is not completely going. It's going how much I want according to my brain capacity. So what I do, I repeat it on the next day. Again short-term, when I sleep today, it will go into long-term. To the cortex. Understand? So the people who are not sleeping, they will have a problem with the long-term memory. The people whose hippocampus is being removed, they will be alive, but they cannot remember HM. How did we discover that short-term memory is stored in the hippocampus? There was a person called as HM. His name was HM. Henry something, okay. So he undergone a surgery. Accidentally, the surgeon removed his hippocampus. So the surgery was like when he was like 30s or 40s, I don't know, remember the age. But after that, whatever he had a, actually he had a toothache. Okay, so he went to the dentist. No, he had the toothache. He went to the surgery. He came back, and then he went to the doctor for dentist. He got removed his tooth. Daily he goes to the dentist because he still remember that he has a toothache. From that day, he has only 1 day memory. You understand? Like for example, today from the morning I am doing something till night, till I am sleeping, I have the memory of the day. But tomorrow when I wake up, I have the same memory before my before my hippocampus got removed. He is alive. He was alive for a long time, but then he never created a long-term memory after that.
So you can remember all your life, but not your new life.
New life, because it's not going to long-term.
Yeah. You can remember your childhood and everything?
Everything
Yeah, okay.
till
Everything
before the hippocampus was removed.
okay.
But after that, it is not creating any long-term memory. So you cannot remember whatever is happening. For the day you remember until you sleep. Morning you are doing something, till evening you are remembering. The moment you sleep, gone, flashed. It's interesting, right? That's how memory is been stored. When it goes to the cortex, we have a memory. Now we do associations with it. There are a lot of classical experiments, Pavilion and all those things. Whether the dog was salivated. How? Because now again we are learning into the behavior part, right? So what do? The owner gave him like a foot on a day. What he did, next day he whistled and gave the foot. He did for a longer time. So whenever he keeps this foot, this dog salivates. Next day onwards, he stopped giving his food, he just whistles. The dog starts salivating. Why? Because he thinks, oh, now food is coming. It starts salivating. Experiment is called as classical Pavlovian experiment associated with memory. That's how we train the organisms. We associated it with certain things to understand your behavior. For example, for us, the taste is associated with the smell. Few people, it is associated with the color. Few people, it is associated with the name. I get the imagination the moment I hear that food name. So, associations are there. The memory is created later on with the association. So, I said whenever a person is in the depression, change the memory. Associations you have to change. You have to connect it with the new associations because brain is habituated. That's how you work on the brain.
The separate sample.
Sorry? Every nervous system, because nervous system, wherever the things has to move, mobility, Vata is associated with it. Nervous system, moving, everything moves. Vata. When you have a problem with Vata, you will have a lot of problems with the nervous system. It do not have to be stress or anxiety, it can be anything, epilepsy, anything, any neuropsychological disorders. Okay, clear? So, to reduce the Vata, what we do? We increase the Kapha. Wherever you have to increase the Kapha, you have to decrease the Vata. So, how do you do that? By Ahara, yoga therapy, by Ahara. I am deleting any doubt you have, you can ask from the board or from. We have yoga therapy. Ahara Vihara. Ahara, which increases the kapha, all the Madhurahara, again, all the sweets. That's why we eat sweets when we are depressed. Vata decreases, kapha increases. You avoid sweets when you have cold. Any sweet food like milk, curd, any sweets, you avoid it. Why? Because it increases kapha. But when you have a nervous system problem or joint problems, you have to reduce the vata. Automatically your body want sweets. So your body is pitta and vata.
Yeah, so I want
So you always crave for
Yes.
sweets.
But not, I don't eat so much, but yeah.
But the people who are more fat, it depends, like for the day, if you have kapha increased, you will crave for the spicy food then. If you have a cold today, you will feel like having some spicy food today.
So obesity is kapha, right?
Obesity is kapha. So kapha people crave for spicy food because it increases their vata and reduces their kapha.
And Vata is a leaner people.
Vata is for the leaner people, or it can be pitta also.
But we don't always crave for what we really need, right? Like,
If no, I'll tell you, your body knows what exactly you want, but you want the taste. So what you do is you manipulate it. You don't go with the body, what is required by the body. You manipulate it, you go with the taste.
yeah.
So if I'm craving for sweets, I can have a lot of sweets. I can have dates, I can have raisins, but I have associated that sweet memory with chocolates, with sugar. My body requires sweet, but I am having something junk. So I am not having what I want, but my body wants what I want to have. So we say that listen to your body. Our body knows when to stop because satiety center is active. I know when to stop my food, but I don't stop because I am craving. My nervous system, my thoughts, I want to have more because my taste are still active. I know my stomach is full, still I eat because of the taste. My body knows when to stop. My body knows when to eat. My body knows what I am craving for, but I don't go with the body. So say when you make it a habit not listening to the body, then body will not listen to you. So you have to make the practice back, listen to the body back, listen to your appetite back, listen to your satiety centers, listen to your hunger centers, listen to everything you have in your body. Your body knows much better than you. Physiological changes you have, for example, when you make a habit of using fan all the time, you need fan. But sweating is good for your body. So body sweats. It do not needs fan, but you need it because you have habituated to it. When you can actually stay for a longer time on your sun, your body knows when to burn it. So you will get a burning sensation. But you don't go to sun just because you have associated it, I have a burn. But when you train it, you can go to the sun for a longer time. Like that, you habituated your body entirely physiology to certain things where you are compromising. So, ahara, kapha increases. For increasing kapha, what are the three foods we eat mostly? Sweet. Amala is sour. Lavana. Lavana is salt. If you have any nervous problem, you increase the sweet, sour and salt. Sweet doesn't mean sugar, refined, nothing. Sweet doesn't mean, sweet just means rice, dal, your pulses, your cereals, your ghee, your butter, your dates, your fruits, your all these are sweets, carb.
So, like grounding food, right?
Yes. So you can increase it when you eat healthy food when you are depressed. You eat more healthy food when you are depressed. You can have it really. So salty and sour. Fine, done. Vihara. Ahara, vihara, rasya. Obviously, the liquid food you have to take. You have to take the rasya, snigdha, the oilation, good oil, good fat, good sour, and all those things you have to take. Vihara. Vihara is your habits. Your habits are yama, ahimsa. You become automatically, when you are stressful, you become more into the ahimsa part. You become so toxic to people, to everyone around you. So you have to follow ahimsa. Ahimsa are of three types. Manasa, vachaka, karmana. Manasa is thought. Vachaka is when you speak. Karmana is when you do. These three things are majorly in the Ahimsa. Then again 3 things: direct, indirect, through someone. These 3 things should not be done. 6 things should not be done. What? You should not hurt by speaking. You should not even think about hurting them. You should not do anything which hurts them, which hurts anyone. Ahimsa. Directly you cannot do, indirectly you cannot do, through someone you cannot do. Ahimsa practice. Okay? Yoga teaches it, especially for the stressed, depressed people. Second, Satya. Satya is honesty. You have to be honest towards yourself, towards others. Third, Yama Vihara is Asteya. You should not be dependable on anyone for their things. You should not be dependable on emotionally, financially, or anything. You have to earn for yourself. You have to do. You give, dan. You should be the source of maker. You should make. You should be giving. You should be thinking, I should give emotions. I should be giving love. I should be giving my finance or whatever it is. So you are not in the receiving end. You will be happy because you are not expecting anything in return. Yama, Yama. Charya. So the people who are into the depression, the best way to release dopamine, have sex with random people.
Lots of clients this way.
My teacher too.
Why? Because it's releasing dopamine. Then you end up having STD. You have WATS, sexually transmitted disorders, and you end a very bad mental state because you will be so addicted to sex that you cannot survive without sex when you are having it, especially under depression a lot. You will be crying for the girl who left you, but you will be having a random sex without knowing her face. So, Brahmacharya, celibacy. Why? Because in yoga, virya is a very important thing. Virya. Why? Because this is the only connection where the Sushma and Sthula, gross body and subtle level combines. You imagine, yeah, I am explaining that. This is the thing which I am explaining. Because the point where you can give rise to an individual, the progeny comes out of that virya. Ojas. Why? Because the subtle level is Atma, or the causal level, or the Atma is a very different level, and you are attaining a gross body in this world. You are taking the world from that point. So you just imagine how powerful that point will be in males and females. You are giving rise to a new progeny. It enters through the subtle level to the gross level. So the energy there is very high. That's why in yoga you say that concentrate on your Brahmacharya. Because the person who is practicing meditation, if they have to rise, their Brahmacharya has to be preserved. Their virya, their sperm, their ovum has to be preserved. It should not be released outside. Because this is the energy which you are going to use through the Kundalini. So Brahmacharya is very important. And when they
So no more sex.
no, everybody can have, but only the relations like
Human beings, the planet is safe.
no, it's not of any conditions. It's not about the marriage, it's not about anything. It's about you are not doing sex. Basically what yoga teaches, okay. We have our own concepts, but I don't what yoga teaches. Sex is for the reproduction, for the kids. The humans are the only organism who gets into sex just for the pleasure. The other organisms only go for sex when they want to have reproduction. So humans, we do everything for pleasure. We eat for the pleasure. We do sex for the pleasure. We do everything for the pleasure. We gather things for the pleasure. We don't need that much, that also we gather, right? So humans has this tendency to gather everything, to go for everything. So this is why this all yamas are applicable only for humans, not for animals. Okay? So celibacy is something where you have your sex with the partner. You don't have for the pleasure of, just randomly. So when you are under depression, you should practice celibacy, because definitely it will destroy your mental state. Then the third is the Neomars practices Shaucha Santosha Tapa. Shaucha, yeah. Okay. The best thing for depression is go lie down in bathtub. You know that? Be in water. Depression's the best thing. Be in water, float on the water, be in the tub, have a warm bath.
But depression is also like having a bad day.
Yes.
So that can be
Yeah.
depression.
No, yeah, it's not depression. It's just stress. Having a bad day is just a stress.
So when the stress
Depression.
gets
Stress gets prolonged. You become habit. It becomes your habit. Maybe the conditions are not around you anymore, but you will be still depressed. Depression is a clinical psychological problem. Stress is not. Have bath. Yoga teaches you to take bath. Shaucha. Cleanliness. Right? So, what you have to do? Take a switch on your shower. You're depressed. Take bath. Santosha. Yoga tells you to practice santosha. Be happy what you have. Be satisfied what you have. Be completely satisfied and tell him or tell whatever you want to. Just tell, I am so much blessed. I'm so happy. I'm so blissful to my life. What is being given to me. Oh my God, I'm so happy.
This is really hard during when you have.
When you are depressed,
especially
it's
when
very
you,
difficult.
When you tell someone who is in depression and tell them, oh, but you have so much.
No,
It's
that is going to encounter, because his memories, major part of memories is associated with some happiness which he has made up in his mind, right? In his mind, there is something other definition of. Now you tell, be happy, he'll be irritated on you. So it's not just one way to practice it. You have to practice everything, the physical changes, the mental changes, everything, the environmental changes. You have to make everything different to come out of, because you have not developed that depression in a single second, single moment. You have been depressed from a longer time. You cannot change it in a day. You have to accept it. I have made it an habit. It will take for a few months. When you realize it, you will start working on it. It will not happen in a month. It will not happen in 2 months. It will happen in a longer month. And then the happiness become your habit. Nobody can make you sorrowful. True. For example, you are a very happy person. Whatever happened, I'm happy. What will happen? If somebody attacks you with any sorrow, anything, you will be happy. You don't know how to be, sad anymore. Because you are so happy, it becomes your habit. Nothing can make you sad. So it do not happens in a day. You have to work for a longer time. Yoga teaches you to be happy. They say, be happy. Modern science teaches you to be happy. Whatever you practice, just be happy. So that is santosha. Shaucha, tapa. Tapa. How do we practice it, tapa? Any problem we have physiological, like any problems, the best way is to detox your body. Detox your body. So, detox. So detoxing your body is something when you basically eat good or don't eat. You fast yourself for 1 time or 2 times. You can have in the night or you can have in the morning, then fast for the whole day. But intermittent fasting is the best way. How do we do that? Tapa. 16 hours, 16 ratio 8. You keep a 8 hours window, 16 hours you fast daily. or else few people practice 24, 20 hours they will be fasting, 4 hours they will be eating. But it is bit difficult, it is better to get into 16 into 16 ratio 8. How do you do it? 6 o'clock you stop eating in the evening, morning 7, 8, 9, 10, 11, 12, 6 hours plus 10. So, you eat next morning 10 o'clock, 16 hours complete intermittent.
That's possible.
It is very much possible. So, now you are not hampering your system at all. How?
Why is that good?
Yes, I will tell. Because our body is a thing which has the capacity to recover itself.
Oh, it's like the keto
But
diet.
stop can be with any spiritual practice, no?
Sorry?
Any kind of thing. Stop is any kind of spiritual practice can be, right?
What, tapa? Yeah, it can be. Yeah, I am telling how to apply it in yoga therapy. When you talk philosophy, it is spiritual practices, different types of but when it comes to the therapy part, tapa is basically done by fasting.
Yeah, because this is
Or
mental will
yeah,
right?
yeah, so
You can do
controlling your
asana
mind,
practice also with that, also with the,
but it becomes your habit afterwards, then you are not doing tapa anymore.
but physically if we are working with our system, right?
Yes, then you have to, for example, asana sthiti is a tapa. You are in pain, but you are bearing it. You are in a pain, but you are bearing it. Any pain which is you are not habituated to it is tapa. But you know what is good for you, you are practicing it, it is tapa. Burning yourself. Asana to say how much, ah ha ha ha. When yesterday I was like, oh my god, I am done. This is my last tapa. Best practicing for anxiety stress. Ishwara pranidhana. Whatever religion you are, whatever thing you follow, whatever master you follow, once you are under stress, you think like he'll take care of me. Dedicate yourself. Whatever he says, I'll do. I don't have. Most of the people who follows religion, this is the best thing not to get stressed.
Yeah, in India,
During the best kriya for stress, anxiety, psychological disorder is Trataka.
But you will cry. I was thinking about this one, but
Trataka. Why? Because
because you clean your eyes.
because you're concentrated on a point, your thought process is on to that point, you're focused on that. It's kind of a meditation, it's a preparation for meditation, right? You're concentrated, you are so much relieved, you're so much relieved. Best anxiety, depression, do Trataka, improve your eyesight and release your stress, right? Second, because it hampers your physiological changes, digestion and everything, every kriyas can be done during anxiety according to the patient's need. If they are too much depressed, they cannot perform, that is different case. But every digestive, dhauti, nauli, basti, everything, because every constipation they may have thyroid problem, they may have heart problems, they may have hypertension high, they may have digestive problem because they go anorexia a lot, they don't eat, they starve or they overeat. So, digestive juices should be secreted properly, digestive things should be tingled properly. In every Trataka, Vamana Dhauti, Vahanisara, Nauli, Basti, everything can be done during the. So, you are more physically active. Oh, anxiety, physically active. Oh, good. If I am depressed, I can be more physically active. I have to be active. It will divert your mind a lot. Third is asana. What are the asanas we can practice? Most common asanas and more powerful asanas. Balancing asanas, meditations, right? Balancing asanas. Why balancing asanas? Because in balancing, we have to think about the balance. We don't have any other option. How much depressed I am, I have to balance my body. If I am falling, I have to balance. So, when you trigger the balancing asanas again and again, it is going to affect your stress level. Stress level. Why? Because you are more concentrated on your body. You are more concentrated on your breath. You are more concentration on your balancing postures. You are more concentrated on everything you do. First. Second,
Grounding
for
as
example, yeah.
like increasing kapha.
Yeah, increasing kapha, which increases very good because the thing which increases kapha can be done steria, whatever asanas it is, you can attain maximum. It will release your stress. Please don't apply today. You are focusing on your body more, asana sthiti.
Also,
Any
so yin yoga is really good then.
very good. It activates your parasympathetic nervous system, right?
Yin yoga is the retreat.
So any parasympathetic you are going to activate through asana sthiti, you can activate it.
You can write a more restorative yoga.
Yeah, come on. Tell me a few balancing asanas, please. Virabhadrasana. Virabhadrasana 3 is the most balancing asana. Then Vrikshasana. Vrikshasana, right? We are maintaining the tree pose. Virabhadrasana, we are maintaining the balance when we are lifting the leg and keeping ourselves straight. Then Navasana, we are trying to be balanced with our body. Then standing asanas.
Uttita Padangusthasana.
Yes, Uttita Padangushtasana, where we just lift, okay, and then the Ardha Padmasana, when we do it with the Padangushtasana, right? Then
But even Trikodasana.
Trikonasana is a balance. Even Parshavakonasana is balancing, right? Then, very good, very nice.
The crane, the crow, crane.
Yeah, also all the balance
balancing by
balance
Yes,
asanas.
Bekasana. Then,
In Sanskrit.
yeah, good. Shishasana, Shalabhasana, right? Then, yes, very good.
Ardhachandrasana,
Yes, Ardhachandrasana, balancing asana. Then,
And the headstand is probably also good
headstand,
from
that
the
is
strength
Shirshasana.
perspective, no?
Headstand, Shirshasana is very good for the stress, yeah. Then, but Shirshasana is very advanced level, so patient, you have to be conscious about it because how long they are practicing it, even the Sharvangasana, all the, higher version of asanas, you have to be conscious about the patience, okay? Yeah. Then,
I don't think so you have psychology disorder.
more 5, 6, 7, it's very easy, come on. Pranayama, what is the disorder we are going to cure with it? Vata disorder we are going to cure with it. Which pranayamas for Vata disorders? Starts with Nadi Shuddhi, very good. Starts with always Nadi Shuddhi. Practice Nadi Shuddhi, definitely. Brahmari for anxiety, definitely. Brahmari, wow. Then, please, come on. Vata disorder. Vata disorder. The best thing, the best pranayama for the reducing the Vata. Come on. Come on.
Say for you, no? I will not say because we are in different pattern. So let
The West, in the shloka itself, they tell Vata Ghanam, Surya Bhedana Pranayama. Whenever you have any Vata disorder, practice Surya Bhedana.
Then don't you think it depends on what is the problem of the person?
Definitely, if I have multiple problems, but any psychological problem, you can give Surya Bhedana. But yes, definitely the person has peptic ulcer, then you have to think about the Surya Bhedana. You have to implement Chandra Bhedana with it to balance it. Understand? Yeah. So any psychological disorder, start with Surya Bhedana. Oh, you have problem? Start. So Surya Bhedana, most of the people are always in stress. So we give Surya Bhedana every time.
But if they are like stressed like this, it's not good, no?
No, if they are getting epilepsy, then you can only go with the pranayama. You cannot do anything else.
No, but I mean if they are like stressed but like nervous. Like,
You can do pranayama, you have to. Then you only give, if the condition is very severe, then you can only give shavasana. You cannot give even meditation. If the condition is very severe for the anxiety or depression, then you cannot go for anything. You cannot even go lecturing them. You can just ask them to sleep in the Shavasana and follow up. Then the next thing, the Bhastrika pranayama is the pranayama which you can give in all the tridosha, but it has a lot of limitations. Why I did this is why I didn't include it in peptic ulcer or constipation. Why? Because Bhastrika pranayama is the only pranayama which can actually applied for all the tridoshas. It balances all the tridoshas, kapha, pitta or vata.
What is it?
Bhastrika, when it's kind of a kapalbhati, but you apply bandhas on it.
Ah, okay.
Okay. You do, right? Bhastrika, yeah.
Why is it balancing the three doshas?
Because every physiology things is getting affected. The person have migraine, the person has digestive problem. So anything which is relaxing for the digestion, like acidity they may have because of the stress induced, you give Shitali Sitkari at that time. If the person is diabetic, you give Surya Bedana, right? If they are overeating and they have thyroid problem because of the stress, you give Ujjayi Pranayama. So the best, yes,
Okay.
Ujjayi Pranayama, because it is basically for the thyroid gland and kapha dosha.
Okay.
Then the best is Brahmari, because stress, anxiety, depression, give Brahmari, do Brahmari. So the best thing in stress and anxiety is you can apply all the pranayamas into it, right? All the pranayama you can do during the stress anxiety. Then coming to the mudra bandha. Now you have to tell me what mudras, what bandhas. Tell, come on. It's been like third class, you know all the things now. Then anxiety, if it is gone beyond, you cannot do, I told you already, do Shavasana, but Sarvangasana, the best, that is Viparita Karni Mudra, right? Shanmukhi Mudra, right? Because concentration. Those are the two. Mahamudra, digestive system, because the digestive system is affected because of the stress. Mahamudra can do, right? It's easy. Bandha, how these three bandhas are going to affect my stress level. Tell, now connect it with yoga therapy. Let me see how you are going to explain the bandhas. Moola bandha, how it is going to help me for the nerve system. Think.
It's at the base of the spinal cord.
It's because Moola Bandha is the thing from where it arises, our Kundalini, the nerve plexus in physiology, all the nerve plexus ends in that point. So when you are applying Moola Bandha, the stress is going to get affected. Uddiyana Bandha, because all the stress problems gives the secondary complications are with the digestive system. So everything, when you apply Uddiyana Bandha, every digestive system will be affected. Then the thyroid gland, the most important gland in our endocrine system, when you apply Jalandhara Bandha, the thyroid gland is going to affect. So you can apply these three bandhas during the stress.
Can you one time repeat all the nerve systems ends
Nerve plexus ends in the Mooladhara.
Mooladhara only?
Yeah. Every, like there are a lot of nerve plexus, but most like it's a huge cluster of nerve plexus. So our body can be maintained through this point, Moola Bandha. So it's very important. That's why it's perineum. It's perineum. It's between the genital and anal portion. So it's called as perineum. So whatever asanas you do, meditation asanas, every feet is going to compress your Mooladhara. You know, physically you do it. Yeah. The most important thing for anxious or depressive patient, you give meditation. You give meditation the way they want, which is more relaxative. I have cured a lot of patients with this meditation. Really, I have seen the results. The people who are very much stressed, oh, they just love meditation. They, even if they are doing for 20 minutes, they feel like they get this heavenly feeling.
So there is probably guided meditation or like
Guided meditation,
it's better because
yeah.
otherwise they get lost.
That's why in
What
India they
now?
chant mantras.
Or mantra.
It gives a very positive vibration. It improves your alpha. In Western countries or in now also in fitness and all, what they do with guided meditation, they ask us to realize our own things, you know, realization.
Or the
They try to,
visualization as well.
it's called as NLP, like neuro linguistic program, if you have heard about it. So they rewire your brain. Rewiring means again the single line is becoming thicker with something else. Rewiring. So it is guided. You can do by yourself, but it's difficult because you have to repeat in yourself. So if you are not a patient, then you do it on your mantra. Because why do we use mantra? Why? Because as I told, nothing can be relearned. Nothing can be unlearned. We cannot unlearn anything. So when we do meditation, we don't have a mantra. What do? We are going to repeat the same thing what we are repeating from the morning. Oh, I have to go there. Oh, I was doing that. Oh, this guy is like that. This person is like that. This thing I am going to repeat. When I have a mantra, I'll be concentrated on the mantra. And this mantra is very powerful because it has a totally different concepts. If we talk about the anatomy and physiology of it, it exactly strikes on the parts where it has to, because the sounds comes out of it has a lot of physiological impact.
You mean some?
But the not least one is relaxation method, that is Shavasana or Makarasana. Physiology of meditation in anxiety, how we are going to understand it? Bandhas is applied, every asanas benefit, the mind gets into tranquilization. You are chanting, you are concentrated or focused on one thing, so you will be stress relief completely. Right? You are turning your anxiety to a single mode where you are positive. Everything arises out of mind, everything is becoming positive now. Right? You are working on your subtle level, you are not working on drugs. Everything arises from the thoughts. Thoughts changes your neurophysiology. You are not working to the neurophysiology, you are working directly to the base, which will change your neurobiology, neurophysiology. Relaxation. You cannot sleep. You have insomnia, you have sleep apnea during your stress level. Or
When you say you're working on the base, means like what, the prana?
from where it arising. So it's not base. Prana is not the base. Prana is just a working property. Buddhi, Atma is the base above Buddhi. So you are directly working on your Atma, soul, from which your bodies are getting affected. So when you are doing meditation, you are working on the base. Any therapy comes out of anything is just the final product. It's just side effects. It's just symptoms of something we are working from the base level. Understand?
That's the reason why you said that all the other points can be
Yes,
skipped.
yes. That's why meditation is the ultimate. Then you relax. You relax in Shavasana, where your entire physiology, which is already got affected because of the stress, is getting completely relaxed, and your entire circulatory system, let it be respiratory system, let it be digestive system, let it be nervous system, everything is completely relaxed and you are out of your anxiety and stress. The patient is relieved. Done.